Okay, it is the top of the hour. I want to welcome everyone to today's webinar. My name is Dr. Eric Toring. I'm the Senior Vice President for the American College of Veterinary Preventive Medicine. And again, want to welcome you today to the webinar. This webinar is available to not only American College of Veterinary Preventive Medicine diplomates, but also active members of our partner organizations, the American Association of Food Safety and Public Health Veterinarians, the National Association of Federal Veterinarians, and the U.S. Animal Health Association. I will turn it over to Dr. Suzanne Thomasy, who is the chair of the ACVPM Continuing Education Committee. Suzanne?
Thank you and welcome everyone. I would like to welcome Dr. Lauren Seal. She is a graduate of the Ohio State University, where she received both her DVM and her Master's of Public Health. She has been a member of the U.S. Army Veterinary Corps since 2012 and has had several assignments both in the United States and overseas. She is currently the command veterinarian for Southern European Task Force Africa, where she provides professional advice and guidance in the areas of food protection, zoonotic disease prevention and surveillance, and force health protection on the African continent. Welcome, Dr. Seal, and you can continue with your presentation.
All right, thank you very much for having me. I appreciate it. And as Dr. Toring said, happy to answer questions. So we'll go right in the interest of time. So we're going to talk about an overview of food defense plans. Here's our agenda. We're going to talk about an introduction and the definitions, the basics of the Food Safety Modernization Act, and then we'll talk about some of the key aspects of food defense plans, what's needed to be in the plan. And then we'll just do a brief discussion of food defense and public health and One Health realms. One of the keys here is that the food system is growing more complex and more diverse. And I want to bring your attention to this fact, and it's at the bottom, but 15% of US food is imported. And so the realization came that we needed to have a solid mechanism for the prevention of contamination to our food supply. We've got new hazards, new opportunities for adulteration, and there's potential massive impact. The massive impact comes from both public health and the economic effects of contamination of large portions of our food supply. It's important before we dive into food defense to really differentiate food defense from food safety and food protection. And I included food security here for that differentiation. So first, food protection is essentially protecting food from any contamination. So food protection essentially encompasses food safety and food defense. Food safety, which has previously been the focus, is protection for those unintentional contamination. And so when we think about food safety, we're thinking about things like how do we make sure that our employees don't accidentally contaminate, or how do we prevent cross-contamination? Whereas food defense is truly protecting against intentional contamination. And we think about that as a contamination that's intended to cause harm to public health or to the economic value of food. So when we think about food defense, we're really kind of thinking about that. How likely is it that someone will intentionally put something in my food production processes that will cause harm to public health or economy? And then I included food security because I think, unfortunately, a lot of folks accidentally interchange some of these terms. And so I wanted to make sure it was clear that food security is a very different concept. And that's the idea of whether or not all people in a given area, country, state have physical, social, and economic access to safe, sufficient, nutritious food. So you do see safe in there. So food safety, food defense, food protection, that would all roll into whether or not the food is safe, but there's a lot more to food security. Just wanted to include that for reference. And when we think about a food protection plan, these are the three key aspects. We're thinking about prevention, intervention, and response. And as you can see, there are aspects of food safety in this food protection plan, but we're going to focus on the food defense. But if you think about it, any facility that's producing food should have an overarching food protection plan that includes both food safety and food defense. And we're talking about this because food safety has been in the forefront of public health and food protection for a long time. But we really see, especially with the Food Safety Modernization Act, which I'll talk about, food defense needs to be more of a focus. And whether dealing with intentional or unintentional contamination, the same regulatory experts, resources, and industry partners are involved. So there's a new regulation with the Food Safety Modernization Act, but the same players are still involved. And food protection is really when we're talking about methods taken to prevent, intervene, or respond to contamination of food. And that can be intentional or unintentional. But where it really becomes different in the protection plan is that food defense really focuses on strategies or processes. When we're talking about food safety, we're talking about specific techniques. How can we make sure our employee doesn't contaminate? Or how should food be stored or prepared to prevent cross-contamination? But with food defense, we're really looking at overarching processes and strategies to prevent that intentional contamination. The Food Safety Modernization Act is all about prevention, and it came into existence in January 2011, and that's when it was signed into law. It didn't take effect for a few years after that. And this really was this idea that we needed to make sure our food safety regulations were meeting the current need. And we realized that somebody needed to have oversight from through growth, harvest, and processing. And so the Food Safety Modernization Act gives that authority to the Food and Drug Administration. Section 106 specifically deals with protection against intentional contamination. So the key section to the Food Safety Modernization Act that you would want to look at if you're considering defense plan is the final rule for mitigation against intentional adulteration. It was proposed in 2013 and finalized in 2016. Now, I will say, yes, it sounds like 2016, it's been a while. It takes a long time for these regulations to go through draft and finalization. So when you go to some of these websites, and I've got a couple in the notes and on the final reference slide, you have to understand that there are draft rules and there are final rules. Some are still in draft, and some of the resources were still growing, but they are user friendly at this point. So you can go to the website and review all of these. The idea of this mitigation against intentional adulteration is that all domestic and foreign companies that are required to register with the FDA under the FD&C Act now have to meet these requirements. And Appendix 3 of this requirement talks about all the exemptions. And really the big exemption is for very small businesses. So if they average less than $10 million per year for a 3-year period, and I know that sounds like a lot. So a lot of kind of your local food establishments are exempt, but big suppliers of food, both in the US and outside of it, must meet this plan, or excuse me, must meet this requirement. And in that requirement, they are required to create a food defense plan. And again, the mitigations of a food defense plan are all about processes. So we're not talking about specific threats. So we'll talk a little bit about how you identify the hazards, but we're looking at steps in the process where we can take action to prevent a threat. Again, so not specific, but it's all about processes. Before a facility can come up with and create and update a food defense plan, they need a food defense team. They need qualified personnel. And a key here is that the personnel do not have to be employees, but they do need to have training in key areas or job experience that qualify them to be part of the food defense team. And part of the jobs of the food defense team are going to be things such as preparing the food defense plan, conducting the assessments, identifying and explaining mitigations, and performing reanalysis. So these individuals can be from anywhere. You can, you can get them from outside your organization. They can also be from any department within your organization. So I included there, it's a good idea to have folks that maybe aren't working in the processing directly, but have had the training. So personnel from security, maintenance, but also quality control and maybe HR. So you have a lot of insight as long as they have the experience. And the Food Safety Modernization Act does explain what might qualify for an individual, or what might make an individual qualify, but it's not prescriptive. So it explains that they need training and or job experience that allows them to serve on the food defense team, but there is some flexibility in that. And you can review the Food Safety Modernization Act to get that, but it also has curriculum from the Food Safety Prevention Controls Alliance, online training that any facility can access to provide to their employees to create a qualified food defense team. And of course, what is the food defense plan? As silly as it sounds, keep calm. I've got a spreadsheet for that. The food defense plan must be document or documents that include the assessments, the mitigations, and the food defense concepts. But one of the interesting things, there is no required or standard format. Appendix 1 does have example format, so you don't have to recreate the wheel and the facilities don't have to recreate the wheel. But there are key components that must be in it, but truly any format, as long as it meets the required components, is able to be used. It can also be multiple documents. And I'm sure any of you that have reviewed food defense plans, most facilities will have a plan that's multiple documents, and then they'll have a signature or review sheet on top so that as they review, and we'll talk about this in a little bit, they can simply sign a cover page rather than reprint the entire plan. And that seems to be a good practice. It does also need to be regularly evaluated, minimal every 3 years, and we'll talk more about that in a few slides. But remember, the goal of a food defense plan is to minimize the risk of intentional contamination. And I think it's important when a team starts diving into the creation of a food defense plan to keep reminding themselves that the goal is minimization of risk. And I think that tends to keep the team on track. The key parts to a plan. Some of this will look pretty similar. It's very similar to a HACCP plan in that you start with a vulnerability assessment, looking at the facility and determining the vulnerabilities. Then you consider different mitigation strategies, how you're going to monitor the procedures that you put in place, what corrective actions will be required, and how to verify. We're going to go through each one of these pieces in depth through the next slides. I wanted to include this. This is an amazing resource. It is somewhat clunky in how you input it, but it truly helps facilities build a food defense plan. So if you're working with a facility or if you need to create a food defense plan or you're helping someone, this database allows you to create it. And it has lots of resources, including example mitigations. It's got scenarios where you can actually practice and look at, here's my process, here's my action step. What are some possible mitigations? It gives examples for corrective action and verification. So it's really a helpful tool. And this is on the FDA's website, and it is in one of the resources, or excuse me, it is in the references. So I highly recommend you go in and play around with it. Honestly, the hardest part about this website is to find some of the pieces, but once you find the piece you need, I think it's pretty user-friendly. And this is where I just took some screen grabs to show, and this is what I meant when I said it was a little bit clunky. So you can see the picture in the top right is how you input each step. So that's actually the facility description, but each one of those, you can see I blew it up down at the bottom. So you put in your vulnerability assessment, then you put in your strategies, and then you put in your procedures. So it truly walks you through each step all the way from facility information to signatures. And it really, it makes it, I don't want to say dummy proof, but it really helps. So if somebody's brand new to the concept and the team is learning, it walks you through how you should move through it, and then you can print out a solid plan. And I included pictures here. So the first step of any food defense plan is the vulnerability assessment. But I should make it clear that before you can truly do a vulnerability assessment, you do need to have a flow chart of how things move through the facility, because you can't really assess it unless everyone's clear on the process. And that especially comes into play if there's members of your food defense team that don't regularly work in the food processing area or maybe are outside of your organization. So make sure you have that flow chart. But once you have the flowchart, you can use one of these assessment tools to identify significant vulnerabilities and actionable process steps. And I included 2 different pictures that I just found doing a search. There is no set format for vulnerability assessments. These are just a few examples. The Army also has a couple. And you really can use any as long as you realize that there should be a process involved and you want to understand the process, like I said, using a flow chart, and then you need to have a process for working through your flow to identify first steps where contamination can occur, and then determining whether or not those are actionable steps. And you also need to determine the severity of the vulnerabilities. And really, one of the key definitions that the Food Safety Modernization Act and the final rule gives is what a significant vulnerability means. So it basically defines that as a vulnerability that, if exploited, could reasonably be expected to cause wide-scale public health harm. That's a significant vulnerability, and there are other definitions given, but I think that one's really, really worth sharing. And so as you're working through this, again, you're identifying the vulnerabilities, you're determining the severity, and then you're determining where the action steps are. Where can I actually affect the possibility of contamination? There are different methods. Here are the three fundamental elements. You want to consider the potential public health impact, and that really can be considered the severity, the degree of physical access. So this means, can someone get to the food product at this step? And then the ability of the attacker to contaminate the product. Because when you really consider whether or not someone can cause an intentional contamination of a food product, you need to know, can they get to it, and how easy would it be to contaminate it? And you can think about this in a couple of different ways. There's different methods for doing the vulnerability assessment. And it goes into depth, the final rule does, and I'm just going to list them for you here. They're listed as key activity type descriptions, meaning what types of activities occur in the facility. Also, bulk liquid receiving and loading, liquid storage and handling, secondary ingredient handling, and mixing and similar activities. As you're working through your assessment, you'd look at each of these types of activities within the facility because they have similar mitigations, meaning that you might need one type of mitigation for liquid storage, and that might be different than the mitigations for mixing or activities like mixing. So it gives you these categories. And then I included here a screen grab of worksheet 1E. This is to show you that as you work through that food plan builder, you get to worksheets such as this. And it walks you through, as you can see, it's the process step, batch size, the amount of product, how many servings, and it even gives you the mortality rate of the contaminant. So you really can consider, if somebody were to get to this point in my process and contaminate it with this physical, chemical, or biological contaminant, how severe would that be? And how concerned do I need to be? So the worksheets really walk you through it. And here is where you start to identify the actionable steps. Because the reality is, you may find some steps in a process where contamination can occur, but they might not be actionable. So you need to determine which steps are actionable. And you need to have a written explanation for why each step is either actionable or not, especially those that are considered significant vulnerabilities. You do want to write a thorough and concise explanation because that'll help as you identify the mitigations. So you want to be clear, this step is actionable because, and that because then leads you to the appropriate mitigation. If it's actionable because it can be locked or it can be secured or it's under constant surveillance, then that leads you right into the effective mitigation strategy. And you can see, I just want to draw your attention to the screen grab. This is worksheet 1F. So there are different worksheets throughout the process. And so theoretically, you might end up with a whole lot of documents that you would then want to compile for your food defense plan. Once you've identified those actionable steps in your process where you can prevent intentional contamination, you need to come up with mitigation strategies. And the goal here is to identify and implement strategies at each actionable process that provide assurances that the risk is minimized or prevented. And here I want to draw a slight distinction where when you consider a HACCP plan, sometimes you're only thinking about controlling something at the last possible step, whereas the language here really says each actionable step. So if you have an actionable step, even if there's another one after it in the process, you do still want a mitigation at each one. I hope that distinction is clear and I didn't muddy the waters, but I do see that as a difference between HACCP plans and food defense plans. They do need to be risk-based and reasonably appropriate, meaning if the level of risk is high, the mitigation needs to be somewhat more aggressive than if the risk is low. And then they also need to be appropriate and they need to be able to minimize the vulnerability. I think it's really important as well that it's consistent with science. And I think this one's a little bit harder to understand at certain points, but as you're considering, if somebody wanted to contaminate a liquid substance with something that wouldn't mix with a liquid, visual inspection might work, if that makes sense. Whereas if something could easily mix into, let's say, liquid, you're talking about a liquid dairy. If something could easily mix into the milk, then visual inspection would not be an appropriate mitigation. And that to me comes in with the consistency with science. And then I included for you a little picture. It's got the mitigation strategies database. So there is a whole database with potential strategies. No facility has to use those strategies, but they are available as examples. I want to be clear that the facility has flexibility. So a facility could take example mitigations and change them to be more appropriate for their own facility. You can also use multiple strategies. One actionable step could have multiple mitigations if they're appropriate, where either or might work, or you might need to do both mitigations to be effective. And again, I just want to make sure these are facility-wide or process-wide, but you can also use facility-wide security measures. And what I think of for this is things like having a visitor policy. A lot of facilities don't remember that that's a really important food defense mitigation strategy. If you're worried about, if you're trying to prevent intentional contamination, having a clear written visitor plan or policy. So that might be a mitigation for some of these where it's an entire facility process that then helps mitigate something at a specific action step. You can also look at food safety measures that are already in place to evaluate whether or not they could have an effect on food defense. So a facility may have steps that are already in place that were originally created for food safety, but could also be applied in a food defense strategy. And those would be really easy to use because they're processes that are already in place. So you'd want to encourage facilities to look at their current processes and make sure that they're using what they already have on the books. And here are your mitigation strategy components. So you need to have some way to monitor your mitigation strategies and a plan for corrective action if it either isn't done or isn't effective, and verification. And again, this is flexible. Each facility needs to decide how they want to monitor their mitigations. Typically something written and something that can be verified. So logs that might be done by quality assurance or a manager and then are verified by a supervisor. Those tend to work really well because you have multiple people in the process, but they have flexibility. And if there are no actionable steps, there are no mitigation strategies. And I include that because I think as some facilities start to develop these, they may think that no steps are actionable, but then the problem is that they have no ability to decrease the risk of intentional contamination. So really facilities want to identify actionable steps so that they can implement mitigation strategies. This shows you an example mitigation strategy that's on that database. So it explains to you you've got a liquid ingredient storage tank and your mitigation is simply to use a lock to secure the tank. I really like this example because it identifies how easy certain mitigation strategies can be. It's also relatively easy to verify it. So you've got an actionable step at the tank. Your mitigation is to lock the tank, and verification is for somebody to do an inspection. And depending on where the tank is, you might be able to check it all the time, or you'd have a plan for when to check it. And corrective action, if it's not locked, would be to review when it was last locked, lock it, and maybe retrain employees. So this is a great example for folks that are new to food defense to kind of work through that process. And I gave you a little bit of foreshadowing into the monitoring. So food defense plan and mitigations only work if they're being monitored to ensure that they're operating as intended and that they're being checked as frequently as needed. So this phrase really hits home to me in that it's a planned sequence of observations. So there needs to be a note as to who is going to check a mitigation and when. So again, in our example with the tank, we need to answer, what are we checking? That's the lock on the tank. How? Is it a visual inspection? Is it, they've got to pull on the lock? And that might be a bit much for that example, and then when? So is it continually monitored because the tank is in plain view all the time? Does it need to be checked once a day, twice a day, at every shift change? And who's going to do it? the line personnel, the manager, the QA. And you want to make sure that the facilities understand the key point to this is they have to maintain logs that it's being checked and verified. Because if you're not keeping records of it, then you can't prove that it's being done. And then you can't look back to consider, is this a functional mitigation or not, if you're not logging it. Corrective action. Once you've got your mitigation and you've got your plan to monitor your mitigation, you then need to determine what the corrective actions will be to identify and correct it. And you want to do these 3 reductions. You want to reduce the likelihood, the access, or the ability to contaminate. With the tank example, it's very simple and straightforward. If unlocked, lock it and retrain employees. But I think one of the things I've noticed is looking at facilities' food defense plans, they forget to document corrective action. And I don't know if others have seen this, but I'll see a really solid food defense and food safety plan with these great, they've got a plan. They know that if this isn't correct, if it's not locked, they relock it. Then as I'm looking at the logs, they forget to have their employees or their supervisor document that they took the corrective action. And that's a concern because that to me tells me, does the facility know the process or do they not know the process? Because if they're just not writing it down, okay, great, they know the process, but they're not documenting it. But I don't know for sure that every employee knows the process, or there's some employees that don't know there's a required corrective action. So it really needs to be documented. And again, there are corrective actions in your FDP that provide the how-to guide. And the way I think about the how-to guide is any employee should be able to read the food defense plan and know what to do if a mitigation isn't correct. Now, hopefully a brand new employee isn't making the corrective action, but you really want to know that your employees know what the action is and who to tell what has to follow when a mitigation isn't in place. Now you need to verify. And it's really important that you're verifying multiple things. First, you're verifying that the mitigation is being done and that the corrective action is being done. And that's where that appropriate decisions are being made. So when you need to know if the personnel in the facility know when to take the corrective action, and that's the appropriate decisions. And then you really need to verify whether or not the mitigations are properly implemented. And I think about this, let's say there's a lock on the tank, but it's not actually sealing it. It's just locked to one side. So that to me, okay, the lock's there, but it's not actually achieving the attempted mitigation of locking the tank. And so as you're looking at the verification, you're looking at the application of methods, procedures, and evaluation to determine if the strategy has been operating as intended. A lot of fancy words for saying, is it doing what I need it to do? So again, we're talking about a written verification and we're checking the logs to make sure the corrective action is happening. So again, I think that's the biggest flaw in a lot of the food defense plans I've seen is they're just not documenting the corrective action. Reanalysis, everybody's favorite part. You have to make sure that these facilities have current and accurate plans. The absolute minimum for reevaluating a food defense plan is every 3 years, but they also need to reevaluate if there's a significant change in activity. This to me means they've got a large change to their process. They've added a new processing line or a new product that would absolutely require reanalysis of the food defense plan. They may also need to reanalyze if they've identified new vulnerabilities that weren't in the previous plan, or if mitigation is not working. So if they have a mitigation in their food defense plan that just doesn't seem to be minimizing the risk like they need it to. Lastly, the FDA can actually require it. So they may actually be told by the regulating agency that they have to redo it. I think it's important to note that they can also reanalyze parts of a food defense plan. So if they add a whole new line, they might just redo the plan for that specific line. If they're noticing that certain mitigations aren't working, they might just look at certain action steps, or they might look at the plan as a whole. And you've got to maintain records. I think this is also something that a lot of facilities really struggle with. And I have seen a lot of facilities move to electronic records, which is great when you go to review it and they can just pull it up on, a shared computer screen. But a lot of facilities still have paper records. And I think food defense plans just add one more thing for them to maintain. And I understand how that might be frustrating. But I would remind them that here it does specifically say that it can be copies or electronic. Excuse me. So a facility could absolutely scan previous copies of corrective action documents, verification documents, and keep them on a digital copy and not keep the hard copies. But they do have to be accurate, indelible, and legible. And I don't know about all of you, but when I go and look at records that are kept in a food prep area, they tend to get pretty illegible if folks are not careful. And I think that's something worth discussing as well. When I go to review somebody's food defense plan and an employee initialed that they checked a certain mitigation, but maybe it wasn't correct or there was no corrective action and I can't read the initials or I can't read the corrective action, that becomes a problem because now I can't evaluate the entire plan as a whole or that specific piece. And I do think a lot of facilities don't leave it, this sounds silly, a lot of facilities don't leave enough room for their corrective action. They might have a daily log sheet where they're checking temperatures, but then they have a box that's, big enough for a couple of numbers for the corrective action. And so reminding facilities that they need to have a method to document the entire corrective action. And when it's something where somebody might have to remove a piece of equipment because it wasn't secured or a door wasn't locked, they need enough space to write down exactly what they did as the corrective action. And again, so the food defense plan with all of the sections, this could be a lot of documents, and facilities absolutely want to recognize that this will be, if they have a different section or different document for each section, that will be a lot. They also need all the monitoring of the mitigations, the corrective action documents, verification, and the training records. I think folks forget the training records. You want to have the documentation, especially for the training of your food defense team personnel. You want to be able to provide that to somebody that's assessing your facility to say, these are the individuals on our food defense team, and this is what qualified them to be part of our food defense team. This is kind of my favorite slide, and I could nerd out here a lot. So this is when we really consider, why is food defense important? And I think a lot of facilities don't understand this yet, which is a good thing, because in some ways it means that it hasn't been a risk to them yet, but we have to help them understand it. These are different possibilities of how food defense may come into play. And I think this food defense matrix is incredibly helpful. And I think it's a great visual for facilities because you're looking at the consequences and the actions. And you can see on the right-hand side, lower right, you've got intentional contamination. And so you've got food defense in that lower right corner where there could be harm to public health, economic health, or terror. And that's the intentional contamination. But then you can also see where food safety, food quality, and food fraud all come into play. And so I really like this visual because I think it really helps folks understand the differences in those. But I'm going to give you an example of each one here. So economically motivated adulteration, which is a subcategory of food fraud, is basically when a company has a fraudulent or intentional substitution or addition to increase the apparent value of the product or reduce the cost. And when I think about this, I really think about whitefish. So fish tends to be a big problem with food fraud, where companies will sell lower quality fish but sell it as higher quality. So low quality whitefish being sold as higher quality. And where that can be a risk to public health is different fish may have different levels of magnesium, for example. So in population of pregnant women who are trying to lower their level of magnesium, they may purchase a fish that should have a low level, but because of food fraud, it has a higher level. That's the example there. And then we may think about industrial sabotage. That's the example on that lower corner, that in Japan, where a disgruntled employee contaminated food with pesticides, causing 2,800 people to get sick. That's an industrial sabotage, and you can consider disgruntled employees, competitors and their employees may conduct some level of industrial sabotage that could include intentional contamination of food. And then you may have terrorism, and I included the kind of classic example from 1984 when 751 people got sick when a terrorist group contaminated salad bars at 10 local restaurants. And what they said is they were actually trying to incapacitate voters so that their candidate would win a county election. So here's a group of people that thought to themselves, we want less people to vote so that our candidate's more likely to win. Let's go contaminate a bunch of salad bars. The last one I'll include, because I think that, this was pretty important in the news, was the salmonella outbreak with peanuts. 714 people got sick and 9 died when employees schemed to manufacture and ship salmonella contaminated peanuts and peanut products. Basically, they were identified as being salmonella contaminated on tests, but the company failed to notify consumers. These are all examples where a good food defense plan would hopefully minimize or even prevent these types of intentional contamination. But we talk about this a lot, in my training on the Army side, when we have to, quote unquote, think like a terrorist. So when you're considering a food defense plan and you're evaluating it, you really have to think kind of like a bad guy. If I wanted to contaminate this, how would I do it? Because that leads you down the path of how could I prevent it? Sometimes that's hard for us, but that is an important way to consider food defense. And that actually brings me to my question slide. Next slide. So I went through that pretty quickly, but I think that was the goal, to give a overview of food defense plan, and that gives us plenty of time. I think I see 5 questions maybe in the question and answer. So I'll let Dr. Toring share some of those questions.
Okay, I will go ahead and pose the questions to you. Great presentation. I'll go ahead and start with the questions. We have a question from one individual. Is a food defense plan a part of HACCP?
Good question. It is not, in that HACCP would focus on food safety, because typically HACCP focuses on unintentional contamination, but the two together, I like to think of it as the two together would create a food protection plan. So a really solid food protection plan would have both.
Have a question. You mentioned a lot about the lock on that product hatch. And he's asking, for corrective actions, if the lock is unlocked, the correction is obviously locking it initially, but it's necessary to determine why it was unlocked in the first place. Is there something that needs to be changed? I guess that's more of a comment than a question. Do you have any comments regarding that, Dr. Seal?
Absolutely. That's a really great comment. And I love that you brought that up, and I debated whether or not to go into that in depth, because one of the things I would think about it is I almost consider it, or think about it like a refrigeration breakdown. So I would need to consider, how long was it unlocked? So I'd probably want the facility to have a process for going back and determining, okay, when was it last confirmed to be locked? And so you bring up a good point. If it was locked yesterday and maybe that tank was unlocked all day, are there more corrective actions that maybe we need to dispose of the product that's in that tank because we can't verify that it was secured? Or was it locked 5 minutes ago and quality assurance maybe was just doing testing? Things like that. So I think it's a really good point that the facility needs to understand their process and the risk to that product to then determine how deep their corrective actions have to go. Hopefully that answered the question, but it's a great comment. I completely agree.
Dr. Afima asks, when assessing vulnerabilities, should the focus be on general vulnerabilities, intentional contaminations that have occurred in the past, or specific risks that may be of concern to a particular establishment?
It's a really good question. I think all 3, and I don't want to cheat by answering that, but I think you bring up a really good concept that you should consider. If there's contamination that's happened to the facility in the past, absolutely you should use that to drive some of your assessment. You do also want to consider risk specific to the facility, but I do want to reiterate, it's a lot about processes. So I think you bring up some really good points, and I think a lot of that would go into the flow chart and the flow diagram for the product. So when the team sits down and they work through, when raw materials come in and they work all the way through the process of getting it out of the facility, I think that process will help steer the vulnerability assessments. But I do think all 3 of those things that you put in, that you mentioned, would be part of the assessment.
Have you seen any obstacles? And if so, what are those main obstacles with regard to inadequate record keeping?
Yes, definitely obstacles. And I think, I mentioned some of them. I think where to keep them tends to be, and if others have had different experiences, but one of the challenges I've noticed is that facilities are sometimes hesitant to keep logs on the floor, like on the processing floor, because they're worried about, well, now if my employee takes off their glove to write on this log and then they don't put their gloves back on, little things like that. So sometimes troubleshooting that with a facility helps. I think sometimes folks will tell me that they're too busy to maintain the log. So at times I'll be going through a facility's checklists, and there will be 2 days where it wasn't done, and they'll tell me we ramped up production. So I think that's another challenge. And then lastly, really understanding the importance. My naive hope is that when you explain to a facility why keeping the log is important, they will show that commitment to keeping the log. But I think until they understand that, there's a lot of hesitation at just adding one more piece of documentation to their employees' plates.
Very good question here from Dr. Poindexter. Is there an establishment size cutoff for food defense plan enforcement? Dr. Poindexter visits a lot of small dual USDA and FDA jurisdiction plants as part of a food safety assessment. She asked if plants have a food defense plan, but are they required to have one or just encouraged?
That's a really good question. And I included that monetary amount that Appendix 3 has. I would have to get back to you. I want to say that there's something in there about number of employees as well, but I might be mixing that up. So I will owe you an answer on that. I do believe it's in Appendix 3, but I will verify that. And you said it was Dr. Poindexter. So if you would like to shoot me an email to remind me, I will get you an answer to that question.
Great. Here's a good question. An individual, Dr. Goldman, asked, with the current climate of direct action by activist groups, how concerned should civilian associations be about food safety during their events and meeting?
It's an interesting question, and I'll go back, and I shouldn't laugh about this, but while I was studying for boards, there was a ProMed article about a military luncheon where a bunch of people got sick, and it wasn't intentional contamination. It was somebody brought potato salad that sat out too long and a bunch of folks, but it was a military luncheon, and I couldn't help but chuckle a little. I do think it's something that a lot of organizations don't think about, and they should, especially when I think about things I'm a bit of a worrier, and I think about things like potlucks, how easy it would be to go after a really large potluck. I think it's an important concept. I don't know how we would teach it to civilian organizations yet, other than offering it. I do kind of wonder if anybody's familiar with ServSafe. ServSafe has started to add some of the food defense concepts. Should civilian organizations that do a lot of feeding events maybe be required to do ServSafe, but then you get into state regulations because some require ServSafe, others don't. So I gave you a bit of a wishy-washy answer because I don't know how to solve the problem, but I think it's a really good point that it's potentially hazardous. And, I would even consider political events, a large fundraiser for a political party. Those kinds of events could absolutely be at risk for intentional contamination of food. And I think about in the military, we do food and water risk assessments for those kinds of events and consider food and water defense teams. So, it's a good question. Should the FDA start considering how to support those kinds of entities? And maybe they'll get there. I try to remind myself the Food Safety Modernization Act is pretty young, so maybe we'll get there.
The next one is we can't sample for everything. We can't be everywhere and see everything. So we'll always be at risk. How do we learn to think outside the box to envision risks that we haven't seen before? And I think you mentioned, through your previous answer, those places that could be at risk.
Absolutely. And I liken it to, unfortunately, any other act of terrorism, essentially. And I hate that we have examples to use, but when I think about things like the Boston Marathon bombing, people talked about how somebody set down a backpack and people saw it but didn't say anything. And I think, unfortunately, we have to get folks to recognize those as something that should be recognized and say something, to see something, say something. But, how do we keep putting information out there that if you're at a big political event and somebody, it looks like it's pouring something into the, punch bowl, do you tell someone? And I think, how we educate the general public on that is a question, but hopefully we'll figure it out.
Okay, we've got a few more here if you have the time.
Absolutely.
If food defense plans are required under the Food Modernization Safety Act, what regulatory steps occur if an establishment has an inadequate defense plan?
That is a really good question. And I owe you an answer on that one too. I did not, I'm being naive. I didn't even consider if they don't have an adequate plan. I will say that the regulatory agencies that evaluate the facilities, I can speak specifically about the US Army. So we as the DoD evaluate food defense plans for any facility that has a DoD contract. We can actually delist a facility for DoD that does not have an adequate food defense plan. So I would think that there are repercussions from like the FDA and USDA. And if anybody on here does evaluations for those entities and can answer that, feel free to jump in. But if not, can the person who put that question also email me and I will provide that answer as well.
Do you see any effects that the COVID pandemic response has had with regard to food protection compliance by the U.S. food industry?
That's a really interesting question because I've seen a lot of facilities in Africa recently, and they've had a different effect from COVID. I think US facilities, because they had to implement protection for COVID specifically, I feel like since COVID, have seen kind of an improved process implementation where when a facility establishes, you will do this, I think facilities learned how to enforce those in a more effective way because of COVID. But the reverse of that is, as I'm seeing a lot of facilities, and I bring up Africa because that's where my responsibility is right now, as facilities are coming back from the pandemic and have fewer people, I think some of those processes are kind of struggling because they maybe are trying to ramp up production with fewer employees and they don't have as much money. So some of the mitigations that may have been in place 3 years ago are not. So I think it varies with facilities and how hard hit they were by the pandemic.
The next comment and kind of question is regard to current events, the baby formula issue that's going on right now in the U.S. Although that was unintentional contamination that plant experienced. Do you, in your opinion, see any kind of reevaluation or discussion on what could work differently in the future to prevent this or similar shortages in other vulnerable groups?
I saw a really interesting couple of articles, and I haven't read them all yet, but one of the concerns with something like what happened with the baby formula, when there's unintentional contamination, then you really bleed into the concept of food security, meaning do we have enough manufacturers of a given product that if one is compromised, do we have the kind of manufacturing capacity or supply capacity to meet the demand? And I think that's part of that question too, because there will be unintentional contamination. There will be, recalls and things like that. But I think too, how quickly a facility responds to something like that can have a big effect too. And I haven't dug, if anybody can educate me, I haven't dug deeply into, what the time frame was between when they learned of the contamination and, what the response was. But I think that tends to be a big one, is how quickly the facility tells consumers, fixes the problem and ramps up production. But maybe there should be some regulation on specific products for high risk populations to have maybe better oversight. But I think that is a question for the FDA, unfortunately.
Okay, we're going to do one more question and then kind of a question that will lead, I think, to your last slide. Electronic original copies and electronic records are allowed as documentation. What kind of requirements exist for, version control, making sure that the document is the most current, making sure that documents are not altered or fraudulent that a plant may present to a evaluator or inspector?
So the requirement is that they are original. So it has some of the similar requirements, I would say, to medical documents, in that if something needs to be changed, you're not using whiteout. You're maybe putting a line through and initialing if something was incorrect. Obviously, we can't always verify that. I think there are a lot of things that can be put in place. A lot of facilities will date, and then digital signatures, I think, are great. And then having somebody verify a document. A lot of facilities I've seen will have somebody verify it at the end of the day. And you can't catch all of them, but to me, things that stand out at a facility is if one day is missing, or 1 day's out of order, or if the signature, you can't always tell, this isn't foolproof, but if it looks like the signatures were done consecutively, so if somebody was running through and signing today's, yesterday's, last week's, kind of all on one day, you might question their processes. But it's up to the individual that's assessing them, and it's difficult to verify. I will encourage too that I think when doing an assessment, I really think it's important for the assessor to pick what days, weeks, or months they're looking at, rather than asking the facility to provide a random sample of their documents. Because when I go to a facility, I don't look at the entire 6 months worth, maybe since the last inspection, but I select random dates. I think there's a lot of kind of risk to the assessment if you let other folks, let the facility choose the dates, because they're going to choose the dates that they did correctly. At least most are, some don't.
All right, and I guess to conclude, an individual is asking, is there a website I can recommend and send to new startup businesses if they want to produce FDA products? I've not been able to find a good resource by Googling, and I will go next slide.
Absolutely, yes. And it's, so the draft guidance, so the second reference there, the draft guidance is going to be the most helpful. And I realized I didn't send you, Dr. Turing, I didn't send you the notes version, and I actually have each of the hyperlinks on each of the slides, so you can actually see where I use certain links. So I can send that to you as well. But the Food Defense Builder is on the FDA website. So if you go to fda.gov, and then you go to Food and Food Safety Modernization Act, that is where a majority of these resources are, including the the plan builder, the mitigation strategy database, all of those are there.
All right, well, I think we've hit on just about all the questions, and we're approaching our 1 hour. So I want to thank Dr. Seal for a very engaging presentation, great information. Not something we like to think about, but something we all should think about on a regular basis. So with that, I will turn it over once again to Dr. Tilmacy for any closing comments from the ACVPM Continuing Education Committee.
Thank you. And thank you, Dr. Seal, for a great presentation. It was a lot to take in. And thank you, everyone, for attending today. I do want to send out a reminder, like always, we are always looking for speakers for our monthly CE webinars. Specifically, we're looking for speakers with topics that are clinically relevant. So if you have any ideas or would like to volunteer to provide a topic, please send the CE committee an email or go to the ACVPM website and submit a request for a speaker and/or topic. Thank you, everyone.
Once again, thank you very much. Thank you for attending, and keep an eye out for future webinars. Thanks again, Dr. Seal.